Hello, dear colleagues. So today I will present you the results of one of the latest research of our group, and that is Latvian dentist treatment decisions for caries treatment during COVID-19 pandemic period. I am a dentist, and those who are dentists from you will agree that we have been taught to find caries when we are seeing teeth. When we find the hole in the tooth, we know very well what to do with that. We are very excellent removing damaged tissues and filling the cavities, or removing all the tooth if it's necessary. But do we know how to stop the process? If we will apply the same strategy for this child, for example, and we will try to restore all damaged tissues. For example, we will do a restoration to the occlusal and maybe distal surface of the tooth number 7.4. It's very likely to find the new cavity in the mesial surface next year. Of course, you will say this is the responsibility of the parents or patients, and they have to take care of their teeth. But in the reality, very often patients are really willing to comply with the recommendations, but we don't give them, or we give them in a way that the patient does not understand. And so do we really know how to stop the caries process? And here, just for reminding, already in the 90s of the last century, the meaning of caries as a process was emphasized. Dr. Warren said that caries being a process is intangible and therefore cannot be surgically removed. But sometimes we have to remove carious tissues, which are tangible, so can be removed and replaced. The main criteria to choose between restorative intervention and preventive measures is cavitation. And later you will see in which level Latvian dentists would intervene with the restoration. But here you can see the percentage which of those lesions would have cavity, and therefore which of those lesions, which percentage of those radiographically detected lesions would require restoration. Removing carious tissues traditionally was related to rotating instruments and aerosol generation. We did not talk about this aerosol generation some time ago, but since the appearance of COVID-19, the issue of aerosol generating procedures has gained importance because it could be a potential route of virus transmission. Infected aerosols can contaminate surfaces and objects. Viable coronavirus can be found on the surface for hours and even days, depending on the type of surface temperature and other factors. Therefore, any intervention that minimizes the generation of aerosols may be preferable to minimize the risk of infection during dental treatment. This has led authorities to provide recommendations on procedures to prevent infection during dental care, or even to restrict or prohibit elective dental care. Following the COVID-19 pandemic, the Latvian government ordered a ban of all elective dental care and especially any aerosol generating procedures in March 25 in 2020. Subsequently, on May 13, 2020, they lift the ban and issue a recommendation to delay elective dental treatments and prefer non-aerosol generating procedures. Those national recommendations to restrict or prohibit some dental actions provided an opportunity to evaluate what dentists would do in case of restricted dental care. For example, would they opt to replace aerosol generating procedures with non-aerosol generating procedures? Attend only emergencies, or definitely not attend at all? This is particularly important because, in general, less invasive non-aerosol generating procedures have shown evidence of effectiveness. But we also know that they are underutilized. Hence, the recommendation to prohibit aerosol generating procedures or recommending to avoid them during the pandemic could therefore constitute an opportunity for the use of less invasive treatment against dental caries. The objective of this research is to evaluate the effect of restrictions on dental care, especially about dental caries in Latvia during COVID-19 pandemic on dentists. We did a cross-sectional survey study. It was approved by ethical committee and was financed by National Research Program. And we used already international validated research tool, but we made a lot of modifications according to our objective to see exactly what dentists would do if aerosol generating procedures would ban, or there will be a recommendation to avoid them. And also what treatment they would use for primary and permanent teeth. So we also had to validate this new research too. We selected a sample from all Latvian dentists and we calculated the sample size to be 174. We gave the survey by sending by emails to 1,092 dentists who are registered to Latvian Dental Association, and we also delivered paper form of questionnaire to 294 dentists during several conferences. We analyzed our data by software R and several packages, and here are our results. We received much more questionnaires than required, 373, but the response rate wasn't very high, and that was expected because mainly we did by online questionnaire. But the paper form response rate was a little bit better. But we got very good sample actually, because if you see the division between female and male dentists, this is something like we have in all Latvian dentist population. The specialist degree also a small proportion. And when we see the graduation year, then we see we have had actually dentists from all age groups. So sample was representative to all Latvian dental population. And from this previously internationally used questionnaire, we used some questions to see in which level dentists would intervene restoratively. So in proximal caries and in occlusal caries, and we can see that in case of proximal caries, about more than 70% of dentists would intervene in enamel or outer dentin level. If you remember one of the first slides which I showed you, that it is expected that 60% of those lesions are not cavitated. But there are about 26% dentists who are intervening only in the middle of the dentin, and 6% who would start to intervene only in the inner dentin level. And also you see in which level of occlusal caries dentists would intervene the first time. We also asked to show which treatment method Latvian dentists would choose for 2 clinical cases. There was an additional information that the patient was 20 years old and had low caries risk. And we see that restoration was chosen by almost 60% in the first case and 20% of the second case. Those questions were given emphasizing the dentist should answer how they would do before the pandemic situations. But now let's see from the third part of the questionnaire, where we ask what they would do during the pandemic situation and what kind of dental services would dentists provide in case of banning aerosol generating procedures or in case of recommending to avoid those aerosol generating procedures. And we see that if we ban those aerosol generating procedures, then only 11% would give normal care for their patients. So it will be preferable to give just recommendation. And We also wanted to see what kind of caries treatment Latvian dentists are ready to do in case of those two situations. And we also see that this traditional restorative treatment would be here, the upper diagrams are for primary teeth and the lower for permanent teeth. So we see that for primary teeth, only 1/3 of dentists would choose traditional restorative treatment for caries. Instead, they are willing to use minimally invasive and non-invasive caries treatment methods. And if we see in permanent teeth, then a little bit higher, about 40% would choose the traditional restorative methods, but they are also willing to use other minimally and non-invasive caries treatment methods. There are some treatment methods like Hall technique, which probably is not well known among Latvian dentists, so it's not chosen very frequently. The COVID pandemic has brought pain and death to millions of people around the world, not only directly, but also indirectly due to limitations in receiving normal medical and even dental care. Dentists have been faced with the decision to continue attending patients with the potential risk to their health. In this study, we wanted to explore whether there were any positive aspects of the effect of this pandemic for dentistry. If we compare Latvian dentist treatment thresholds with dentists from other countries, we can see that we are similar to dentists from France and USA, but just Norway dentists seems to be a little bit less invasive approach, even in the 90s in the last century. But we found that most dentists in Latvia would continue to care for their patient needs. We also found that most are willing to adopt less invasive treatments for management of dental caries if the recommendation to avoid aerosol-generating procedures exists. This study has typical limitations of a survey study, therefore it should be kept in mind that the results refer to what dentists state they would do rather than what they really do. However, even with this potential bias, it's possible to see a trend in the results towards the acceptability of non-invasive and minimally invasive caries treatment. Dental personnel are among those most at risk of exposure to COVID-19. According to the physical aspect of our job, we are very near to the patients and we are dealing with the liquid where virus concentration is sufficient to make a COVID test saliva. So on the one hand, teledentistry could provide protection by physically separating healthcare personnel from patients. But even when invasive intervention is required, additional strategies are needed. Some strategies include the use of additional protective measures. On the other hand, there is an opportunity to incorporate treatments with evidence of effectiveness that for some reasons are being underutilized. And this is nothing surprising. Experts around the world are discussing why dentists are so slow to adapt changes, even when a strong evidence of new approaches exists. Our results suggest that the COVID-19 pandemic represents an opportunity to introduce non-invasive or minimally invasive treatments which have shown in high efficacy in treating caries in children and adults. Moreover, non-invasive and minimally invasive interventions have the advantage of generating less aerosol than traditional interventions. So we hope that due to pandemic, the dentists could start to see caries as a process rather than a damaged tissues.